Welcome to another deep dive. Today we're exploring leptospirosis in cattle. Now, this might not be a disease you hear about every day, but its global impact is surprisingly heavy.
It really is. It affects both animals and humans, too.
Exactly, and the estimated productivity loss, we're talking tens of billions of dollars annually. It's a massive one health issue.
Absolutely critical.
So our goal today is to, cut through some of that complexity, understand its reach, and pull out the most important takeaways. Because that financial toll, well, it's almost like a hidden crisis.
It impacts whole economies,
Yeah.
far beyond just individual farms.
Okay, let's get started though. For those maybe less familiar or just as a quick refresher, can you give us the core definition? What is leptospirosis?
Sure. So at its heart, leptospirosis is an infectious disease. It's caused by these corkscrew-shaped bacteria from the Leptospira genus.
Heart screw shaped.
Yeah. And it's a global problem. You might hear it called wild disease, sometimes in humans, or even red water in cattle. That refers to a specific clinical sign.
Red water definitely sounds dramatic. So we're not talking about just one single type of bacteria here, are we?
No, not at all. The Leptospira genus is incredibly diverse. I mean, we know of 64 species right now.
64. Wow.
And out of those, 37 are pathogenic. They cause disease. And those are broken down even further into about 300 different serovars. Think of them as distinct variations.
Okay. 300 serovars. And here's where I think it gets really interesting, especially for producers. There are two main categories of these serovars in cattle, right? Understanding that difference seems key.
It is absolutely crucial. It's this concept of host-adapted versus non-host-adapted serovars.
Okay, walk us through that.
Right. So host-adapted, the main one here is Leptospira harjobovis. It's really the only one truly specialized or adapted to cattle.
Adapted to cattle, okay.
And what's really insidious about this one, the key insight maybe, is that it often causes less severe illness in that specific infected cow.
Less severe. So that sounds better, but
Well, not really, because that leads to a persistent carrier state. These cattle become chronic shedders. They can shed huge numbers of bacteria in their urine, sometimes for their entire lives.
for life. So they're like silent sources of infection.
Exactly, silent sources. And that persistent infection is a major economic drain, mainly through infertility. Plus, it really complicates public health efforts because you have these apparently healthy animals just shedding bacteria everywhere.
And diagnosis must be tricky then.
Very tricky. Antibody levels, the titers, can be really low, so standard tests might miss it completely. It just masks the infection.
Okay, so that's the sneaky host-adapted one. What about the other category?
Right, the non-host adapted. This group includes serovars like Leptospira pomona, L. icterohemorrhagiae, L. canicula, L. grypotyphosa, quite a few others.
And these come from other animals.
Precisely. They're maintained by other species. Pigs for pomona, rodents for icterohemorrhagiae, dogs for canicula, various wildlife for grypotyphosa.
So cattle are just accidentally getting infected by these.
Yes, cattle act as incidental hosts for these non-adapted types. And in cattle, these tend to cause more acute, more severe clinical signs. They hit harder, basically.
Okay, that distinction really helps. The sneaky chronic carriers versus the ones that cause more obvious acute illness but are maintained elsewhere. So thinking about all these different types and all these hosts, how does this disease actually get around? What are the main pathways?
That's a really important question. How does it spread? Well, it's found pretty much worldwide, but the incidence can be way higher in tropical regions.
Oh, why is that?
Sometimes 10 times more prevalent, actually. It's because the warm, humid conditions really help the bacteria survive outside of an animal host.
Makes sense. So what are the main ways it moves from animal to animal or, into the environment?
Well, its persistence and transmission really rely on a huge range of reservoir hosts. We're talking about 160 mammal species.
160. That includes.
Oh, yeah. Feral animals, other farm animals like pigs and horses, pets like dogs, and lots of wildlife, raccoons, deer, you name it.
And you mentioned those maintenance versus incidental hosts before.
Exactly. Maintenance hosts are animals like cattle carrying harjobovis or pigs carrying pomona. They carry it, often with minimal signs, but they shed it constantly into the environment.
The silent shedders again.
Right. And then incidental hosts get infected by a serovar, usually maintained by a different species, like cattle getting pomona from pigs. They might get sicker, but they usually shed the bacteria for a shorter time.
So these maintenance hosts are essentially these living, breathing reservoirs, just constantly contaminating things. How does that contamination actually lead to new infections then?
Well, leptospires are highly invasive. They're good at getting in. The most common way is direct contact with an infected animal or its fluids, especially urine.
So nose-to-nose contact, licking, that kind of thing.
Yep, even sexual contact, though that seems pretty rare.
Mm.
But really, indirect environmental transmission is thought to be the primary route.
Through the environment. How?
The leptospire shed in urine can survive in fresh water for, well, up to 16 days.
16 days. Wow.
And in soil, almost 24 days, if the conditions are favorable, damp, moderate temperature. So animals get infected by drinking contaminated water, eating contaminated feed, or even just through contact with wet soil.
Can they get in through the skin?
They can. They can penetrate skin that's not intact, like through cuts or abrasions. But they can also get through intact mucous membranes, eyes, mouth, nose. They have this distinctive corkscrew motility that helps them burrow in.
Like tiny drills.
Sort of, yeah.
Yeah.
And we also see vertical transmission from the mother dam to the fetus during pregnancy. That's a big cause of reproductive failure.
It really sounds like this incredibly complex web. Environmental factors, how animals interact, even how farms are managed.
It absolutely is. If you connect it to the bigger picture, those environmental conditions, warmth, humidity, heavy rainfall, are critical. And agricultural practices matter too.
Like how?
Well, intensive farming, concentrating animals, or having open herds where new animals are frequently brought in, that can definitely increase transmission. Shared water sources like streams or ponds accessible to multiple herds or wildlife are big risk factors.
Right.
And the fact that leptospira can survive for weeks out there in the environment means the environment itself becomes this persistent reservoir. It makes actually eradicating the disease incredibly difficult.
Okay, so once these tenacious bacteria actually manage to get into a host, what happens next? How does the disease actually manifest? What impact do we see both in the cattle and, importantly, in humans?
Right, so once they're inside, the leptospires spread really quickly through the bloodstream. They head for organs like the kidneys, the uterus, the udder.
Dire organs?
Yeah, and their main effect is damaging the walls of small blood vessels. That vascular damage leads to problems like kidney and liver damage. And even if the animal recovers from the initial acute phase, that damage can cause long-lasting problems, especially with reproduction.
What are the sort of telltale signs in cattle? Does it look different depending on their age?
Oh, absolutely.
Yeah.
The age difference is critical for diagnosis.
Oh, okay. Tell us about that.
So in calves, especially acute cases, it's often severe. You'll see high fever, really bad anemia, and that hemoglobinuria, the red water we mentioned.
Right. The urine looks red.
Yeah, it's essentially because red blood cells are breaking down and hemoglobin spills into the urine. You also see jaundice, yellowing of the eyes and gums. These signs can progress incredibly fast, often leading to death in just 3 to 5 days.
That's quick and devastating. What about in older cattle?
In older cattle, you more often see chronic cases, especially with those host-adapted serovars like Harjo bovis. The initial symptoms, maybe a fever, might be really mild or just go completely unnoticed.
So sneakier again.
Very sneaky. A really classic sign, though, in milking cows is a sharp, sudden, and pretty profound drop in milk production.
A big drop in milk. And does the milk look different?
It can, yeah. It might become thick and yellow, almost resembling atypical mastitis. But, and this is important, usually without the typical signs of mastitis, like udder swelling or heat.
That's interesting. So the milk looks off, but the udder feels fine.
Exactly. It's a curious thing for vets. You see this milk that looks like bad mastitis, but then you check the udder, and it's completely normal. No swelling, no heat. It's almost like the cow is trying to trick you.
Huh. Does the milk production recover?
Often it does, yeah. It usually returns to normal within about 10 to 14 days, sometimes even without specific treatment for the lepto itself.
Oh, okay. And you mentioned reproductive impacts earlier. That sounds like a major issue.
It's arguably one of the most significant and economically costly consequences. It causes infertility, cows returning to heat repeatedly, early embryonic death, and critically abortions.
Abortions, how common are those?
They often happen maybe 3 to 10 weeks after the initial infection. And in some herds, you can see what they call abortion storms.
Abortion storms, that sounds bad.
It is. Abortion rates can hit up to 50% in affected herds during an outbreak.
50%? That's staggering. I mean, beyond the financial loss, the emotional and operational impact on a farmer facing that, it must be devastating.
Absolutely devastating. And you also see stillbirths and weak calves being born. It's a whole spectrum of reproductive failure.
So it's a bit of a chameleon, this disease, presenting very differently depending on age. What about humans? If someone gets infected, what happens?
Right, lepto is a serious zoonosis, meaning it jumps from animals to humans. Human infection usually happens through direct contact with infected animals or their urine.
Like farmers, vets?
Exactly. Agricultural workers are particularly vulnerable because of that occupational exposure.
Hmm.
Or it can happen indirectly through contaminated soil and water.
And what does it look like in people?
Well, there are two main forms. Mild to moderate illness is the most common. It usually presents as a sudden onset flu-like illness, headache, fever, muscle aches, fatigue,
Sounds like the flu.
very much so. It often resolves within a few days, though sometimes there can be a second phase, maybe a recurrence with aseptic meningitis inflammation around the brain and spinal cord.
Okay, that's the milder form. What about the severe one?
That's severe illness, often called wild disease. This is much more serious. It can progress to multi-organ failure and, unfortunately, can be fatal.
Multi-organ failure.
Yeah. Symptoms include high fever, chills, severe pain, and then signs of organ involvement, liver and spleen enlargement, jaundice again, kidney failure. And even if people recover, there can be long-term complications like recurrent fevers, arthritis, or ongoing issues with the central nervous system.
That sounds really serious. And how do people typically get infected? You mentioned direct contact and contaminated environments.
Those are the main ways. Also, sometimes through eating raw dairy products or undercooked meat from infected animals, though, importantly, pasteurization does effectively kill leptospires in milk.
That's good to know. Pasteurization helps.
Definitely. Inhalation is another potential route, maybe less common, but a risk for farmers or slaughterhouse workers
Hmm.
in environments where there might be aerosolized contaminated urine.
Right, breathing it in.
Yeah. And direct contact with infected animal fluids through cuts or scrapes on the skin is a big one. Or even just exposure to contaminated water, like swimming in infected ponds or streams.
Okay, so diagnosing something this varied, this sneaky, mimicking the flu in humans, causing different signs in cattle, that sounds like a real diagnostic challenge.
It is. Diagnosis is genuinely complex. Those nonspecific symptoms mean it can easily be mistaken for other diseases like bacillary hemoglobinuria or babesiosis in cattle.
Leading to misdiagnosis.
Exactly. And the bacteria itself, Leptospiro, is what we call fastidious. It's very picky, very difficult to grow in a standard lab setting. So traditional culture, while definitive, is often just not practical or reliable for routine diagnosis.
Okay, so culture is tough. What about blood tests?
Serological tests, which look for antibodies in the blood, can also be tricky to interpret. Antibody levels might be low early in an acute infection, or they might hang around for a long time after the animal is recovered, or even after vaccination, which can confuse the picture.
Right, so a positive antibody test doesn't always mean active infection. Given all these hurdles, what tools do veterinarians rely on?
Usually it requires a combination of methods. Serological tests are still widely used. The microscopic agglutination test, or MAT, is probably the most frequent. It looks at how antibodies in the serum make the bacteria clump together.
Okay, the MAT test.
ELISA tests are also common. They use enzymes to detect antibodies and can be good for screening, even testing bulk milk tanks for herd-level surveillance. And there are newer, rapid tests emerging.
Rapid tests, like for field use.
Exactly. Rapid lateral flow immunoassays, LFIAs. They work a bit like a rapid COVID test and can give you results right there on the farm in maybe 15-20 minutes. Still relatively new, but promising for quick decisions.
That could be really helpful. What about detecting the bacteria itself, not just the antibodies?
That's where molecular diagnostics come in. PCR, polymerase chain reaction, and quantitative PCR, or qPCR. These are highly sensitive tests that detect the bacterial DNA directly.
In what kind of samples?
Various samples, blood, urine, milk, even reproductive fluids or tissues from aborted fetuses. They're really useful for early detection, sometimes even before antibodies show up.
So, more direct evidence.
Right. And while culture remains the technical gold standard for a definitive diagnosis, as I said, it's laborious, slow, and needs special biosafety labs. So it's not common for routine work.
Okay, so a mix of antibody tests and DNA detection seems to be the practical approach. Once you do get a diagnosis, how is leptospirosis treated?
Prompt antibiotic treatment is really crucial, especially for those acute cases we talked about in calves. Getting treatment started quickly makes a big difference.
And what antibiotics work?
Thankfully, there's a range of antibiotics that are effective. Things like penicillin, streptomycin, octitetracycline, telmicocin, ceftiofur, ampicillin, amoxicillin, even enrofloxacin.
So quite a few options.
Yes, for example, a single shot of streptomycin given intramuscularly at the right dose, 25 milligrams per kilogram, can often eliminate that kidney carrier state, stop the shedding.
Stop the shedding, that's key.
It is. Though some infections might need multiple doses or unfortunately might show some resistance, oxytetracycline and telmicocin are also commonly used and effective.
What about dealing with an outbreak, like those abortion storms?
Yeah. In an acute outbreak situation, especially if lots of pregnant cows are involved, veterinarians might recommend simultaneous treatment and vaccination of the entire herd. That can help reduce new cases popping up.
Treat and vaccinate at the same time.
Right. For those chronic carriers, the main goal of treatment is really just to eliminate the shedding in the urine and reduce further transmission within the herd.
Now, you mentioned resistance. That raises the crucial point. Is antibiotic resistance a growing concern here, like we see with so many other bacterial diseases?
It is, yes. Efficacy can definitely vary, and resistance is something we need to monitor. Plus, there's another complication.
What's that?
Some antibiotics that are effective, like streptomycin, are actually prohibited for use in food-producing animals in certain regions, like the EU and sometimes the US, depending on the specifics.
Ah, regulatory issues.
Exactly. Which means vets need to rely on alternative drugs. And all of this just underscores how important antimicrobial stewardship is using antibiotics wisely. And it highlights the need for ongoing research into new treatments, especially for the genital tract infections, which actually haven't been studied quite as thoroughly as the kidney infections.
Right. Careful use and looking for new options.
Yeah.
So given how widespread this is, how impactful, how difficult it can be to treat, prevention must be absolutely central, wouldn't you say?
Absolutely. Prevention is paramount. And effective prevention really demands a multi-pronged approach, that one health approach we keep mentioning, looking at the animals, the environment, and the human risk together.
So what are the cornerstones of prevention?
Vaccination programs are definitely a cornerstone. There are commercial vaccines available, often called 5-way Leptospir vaccines.
5-way, meaning they cover 5 serovars.
Typically, yes. They target the most common serovars that affect cattle in a particular region, including usually Harjo bovis and some of those non-host adapted ones like Pomona and Grippa typhosa.
And how are they used?
For cattle that haven't been vaccinated before, the primary course is usually 2 injections, maybe 4 weeks apart. Then annual booster shots are recommended.
Annually. And timing matters.
Yes, especially for breeding animals. Vaccinations should ideally be completed before their first breeding or service. This is crucial to help prevent those devastating reproductive losses, the infertility and abortions. The main goal of vaccination is to prevent shedding in urine, prevent the milk drop, and prevent abortions.
Okay, vaccination is key. What else? Biosecurity must be huge.
Huge. Biosecurity measures are essential to stop the disease from getting onto the farm in the first place, or spreading if it's already there.
Like what sort of measures?
Well, ideally, any new cattle brought onto the farm should come from herds known to be free of Leptospira. If that's not possible, then they should be quarantined for at least 4 weeks.
Quarantine and test them.
Exactly. Quarantine, test them, and potentially treat them with antibiotics during that period before they mix with the main herd. Also, basic hygiene, keeping calving areas clean, disinfecting equipment that might be shared, that stuff is critical.
And what about managing the environment itself? You mentioned water sources earlier.
Right. Control of contaminated water sources is vital. Remember, leptospires can survive in water for weeks. So fencing cattle out of potentially contaminated streams, ponds, and marshy areas, that's a really important environmental management strategy. Draining swampy areas where possible can also help.
Makes sense. Reduce exposure points. What about other general herd management practices?
Rodent control is critical. Rats and mice are major reservoirs for some serovars, like the icterohemorrhagic.
Gotta control the rodents.
Definitely. And wildlife control where feasible, although that can be very challenging. If you do have infected animals identified in the herd, segregating them is important to limit further spread.
Keeping them separate.
Yeah. And another point, avoiding mixed grazing, particularly with sheep. Sheep can carry L. harjo, the same host-adapted type as cattle, often without showing signs themselves, and can transmit it to cattle.
So keep sheep and cattle separate if possible.
It's advisable, yes. And, connecting this back, While sometimes during really bad acute outbreaks with lots of pregnant cows, strategic whole hood antibiotic treatment might be considered.
As a last resort, maybe?
Well, it's a complex decision. You
Hmm.
have to balance that immediate need for control against the long-term goals of antimicrobial stewardship, trying not to overuse antibiotics.
Right. Which really highlights why having robust vaccination and strong biosecurity in place is so crucial to prevent getting into that situation in the first place.
Exactly. Prevention is always better and usually cheaper than cure.
Speaking of cheaper, you mentioned right at the start that this disease has a massive economic impact. Can you unpack that a bit more? Just how significant is that financial burden, and what are the main ways it costs the livestock industry?
Yeah, the economic burden is truly substantial. It's often underestimated. Globally, one estimate put the annual productivity loss just from leptospirosis at around 29.3 billion US dollars back in 2019.
29 billion with a B.
Billion, yes, and with projections suggesting it could potentially reach over $52 billion annually. Just in the United States, the estimate for that same year was about $1.3 billion.
Wow, 1.3 billion just in the US. That is staggering. Is that cost spread evenly around the world, or do some regions bear more of the brunt?
Oh, not evenly at all. The highest costs are really concentrated in the Asia-Pacific region. Countries like China, India, Indonesia, Sri Lanka, they face really substantial financial impacts.
Okay, Asia Pacific hit hard.
And critically, what the data shows is that lower middle-income countries bear a disproportionately high share of this global burden. They account for nearly half of the total estimated cost.
Nearly half in lower middle income countries.
Yeah. It really indicates that leptospirosis is, in many ways, a poverty-related disease. It hits hardest in places with fewer resources for prevention and treatment, exacerbating existing economic challenges. It really underscores that one health link to global equity as well.
That's a really powerful point. So breaking down those billions, what are the direct costs that producers are actually facing on the ground?
The direct losses come from two main areas: reduced productivity and increased expenses.
Okay, like what?
Market losses. We talked about that significant drop in milk production in lactating cows. Even if temporary, it adds up. And the long-term impacts on herd fertility reduce overall meat production efficiency, too.
Right, less milk, slower growth.
Exactly. But the reproductive losses are often among the most costly components. That infertility, the early embryonic deaths, and especially those abortion storms we discussed.
You mentioned a figure for abortions earlier.
Yeah, estimates suggest a single midterm abortion can cost a producer somewhere between 600 and 1,000 US dollars. Later term pregnancy losses can be even more costly. And that doesn't even account for the cost of stillbirths or raising weak, unthrifty calves.
$600 to $1,000 per abortion? That adds up incredibly fast in an outbreak.
Devastatingly fast.
Yeah.
And then you have the increased veterinary costs for diagnosis, for treatment, and often higher culling rates because chronically affected animals, especially those with persistent infertility, just aren't productive anymore.
Indeed. So those are the direct hits. But are there also significant indirect impacts, sort of hidden costs that might be harder to put a precise dollar figure on, but still contribute to that massive overall burden?
Oh, absolutely, yes. The indirect costs are huge and likely make up a large part of that multi-billion-dollar global estimate.
Such as,
Well, persistent reproductive failures, even if not causing dramatic storms, have a lasting negative drag on overall herd productivity year after year. Leptospirosis can also weaken the animal's immune system generally, making them more susceptible to other diseases.
right, knock-on effects.
Exactly. Then there are increased labor costs, just the extra time and effort needed to manage sick animals, deal with abortions, rebreed cows that fail to conceive, and potentially trade restrictions if a region has a high prevalence of certain serovars.
Trade restrictions, too.
It can happen. And, you know, that vast difference you see between the global productivity loss estimates in the tens of billions and the specific direct costs of individual cases in the hundreds or low thousands.
Yeah, that gap seems huge.
It strongly suggests that these hidden or intangible costs are a massive, often unquantified piece of the true economic burden. Things like the cumulative impact of subclinical infections just quietly dragging down performance, the long-term decline in herd efficiency, and the broader non-monetary impacts on food security and the livelihoods of farming communities. It's a much bigger picture than just the cost of an abortion. So really, to bring this deep dive full circle, leptospirosis in cattle is this pervasive, economically crippling challenge. And it truly embodies that one health concept, doesn't it? It directly links the health of animals, people, and the environment we all share.
It really does.
It's incredibly varied clinical signs from those acute, sometimes fatal cases in calves, to the really insidious chronic reproductive problems in adult cows that just complicates everything, management, diagnosis. And the bacteria's ability to set up those persistent carrier states, plus its knack for surviving out in the environment for so long, well, that just fuels the transmission risk.
Yeah, it's a formidable foe. But as we've discussed, there are promising advancements, better diagnostics like the highly sensitive PCR tests we talked about, and we know the critical role of these multi-pronged prevention strategies, robust vaccination, really stringent biosecurity.
Progress is being made, definitely.
So, wrapping this up, what does all this mean for you listening and maybe for our collective future? Thinking about Leptospira's incredible persistence, its huge range of animal hosts, and especially those often unseen economic and societal burdens, particularly on more vulnerable communities. What do you think is the single biggest remaining challenge we face in trying to effectively control a complex zoonotic disease like this on a truly global scale? That's something to mull over as you go about your day.